Our New Hampshire Impact Award honors nonprofit employees who demonstrate exceptional commitment to their organization, their community, and the sector, and whose leadership has been integral to significant advancements in New Hampshire. I'm pleased to present a New Hampshire Impact Award to Tess Kuenning. Tess is President and Chief Executive Officer at Bi-State Primary Care Association. Tess has devoted her career to improving public health. In every job she's held, in the testimony she gives, on the boards and committees she serves, and in the classes she teaches. Her leadership in ensuring people have access to comprehensive healthcare services, especially those who are most vulnerable, has resulted in expanded services for preventative care, behavioral health, substance misuse, and dental care for children and adults. Tess is a dedicated leader with a passion for sharing and learning. She is an invaluable resource to her colleagues in the nonprofit sector as a connector, a sounding board, mentor, and friend. Please join me in congratulating Tess Kuenning as a New Hampshire Impact Award honoree and welcome Tess to accept the award.
Thank you, Kathleen. Let me begin by thanking the New Hampshire Center for Nonprofit staff and board for the honor of receiving the Center's Nonprofit Impact Award. I'm very humbled to receive this recognition. The Center plays a vital role in embracing and celebrating the value our nonprofits play in New Hampshire. Nonprofits collectively are organizations with a mission to give back. I want to thank my colleagues at Bi-State who are the backbone and pillar of all our efforts. I'd like to extend my great appreciation to my board, who have provided me with their generous time and support and leadership. Bi-State's mission is to assure all people in New Hampshire and Vermont have access to high-quality, affordable primary health care. Bi-State's work is to assure community health centers can serve patients across the state. So I'm grateful to the health centers, our healthcare heroes on the front lines serving 325,000 people across Vermont and New Hampshire. Last, I would not have had the privilege of working at Bi-State for 25 years without the loving support of my husband Keith and my children Gerard and Annie. They have been steadfast by my side as soldiers for the cause. What attracted me to Bi-State was the comprehensive whole-person, whole-family approach that the health centers use. Health centers provide medical, oral and dental health, behavioral and mental health services, and they treat those with substance use disorder through medication-assisted treatment and community support. Health centers care for your neighbors. They care for your community. They care for our homeless and for our veterans. They care for our moms and dads and children and grandparents, all ages, all ethnic backgrounds, all languages. Health centers take the term healthcare and turn it into caring for your health. The health centers were born out of the 1960s civil rights movement, the war on poverty, social justice, and equity. The health centers have grown to serve 30 million people across our nation. The health centers know the prescription for hunger is food security. The prescription for advancing is education. The prescription for homelessness is housing, and the prescription for surviving is economic stability. The services of the health center have never been more important than now. Health centers have served you for over 40 years in New Hampshire. They've served you during the opioid crisis, and they serve you now during the COVID-19 pandemic. Health centers are open during the pandemic, not only for COVID testing and for symptoms, but for you to get your prenatal visit, your well child care, a checkup on your diabetes, on your asthma or heart disease. Our work at Bi-State is to be your voice, a voice for everyone in New Hampshire and Vermont, for everyone to have a health home, to be a voice with the governor, with the Senate and House, with policymakers and our federal members of Congress. As a clinician having worked in cardiac ICU and in remote villages in Nepal, I have seen healthcare systems that work and those that do not work as well. The health centers are proven healthcare providers that work. Since receiving this award, the world has changed. Our lives have changed. We are living with COVID-19, and we have a social justice movement emerging. And healthcare and our nonprofits are responding to those changes. However, the future looks bright and it looks challenging. Now and into the future, health centers will do more telehealth visits, more home visits. They'll meet you where you are. As Bi-State moves forward, we will work with our partner, the Center for Nonprofits, and our nonprofit community partners in the state to continue the great legacy of this state working in partnership, working together to craft a future that accepts us all, that is open and embracing, and that sees the best in all of us and celebrates together the best of New Hampshire. Thank you again for this high honor and for allowing me to accept this award on behalf of so many who care deeply and make a difference for you every day. Thank you.